So, in spermatogenesis, we know that the gonadotropins, the FSH and the LH both will play a role. You know that both the gonadotropins come from the pituitary after the stimulation from the gonadotropin releasing hormone. Hi, welcome again, and we shall now read about gametogenesis. Now, gametogenesis, as the name is implying, we are seeing the development of the oocytes and the development of the sperms. So, let us see spermatogenesis. First, we know that the spermatogonia, one spermatogonia will give us 4 mature sperms, spermatozoas. So, that process is known as spermatogenesis, and this takes place over 74 to 75 days, some books would say, and some books even say 72 days, but roughly we keep saying it is 3 months period in which the spermatogenesis takes place, but more precisely 74 to 75 days this takes place. And this spermatogenesis from spermatogonia to spermatozoa is a broad term for a few more processes which happen in between. For example, there is a stage where there is formation of the spermatids. So, from the spermatid stage to the formation of the spermatozoa, the mature spermatozoa, this is known as the Spermyogenesis. This spermogenesis takes place over something like 21 to 22 days, and some books say 24, some books say 20 days, but precisely it is actually 21 and a half days, 21.6 days actually. So, 21 to 22 days, whichever question has this choice, you must mark 21 to 22 days, and that should take care most of your MCQs regarding the duration of spermiogenesis. Alright, so what are the events of spermogenesis and all, we will discuss as we go reading about this. So, this is spermatogenesis and spermiogenesis, and then what is spermiation? Now, spermiation is the release of the sperms. Release from where? Release of the sperms from the Sertoli cells into the lumen of the seminiferous tubules. So, release of the sperms into the lumen is known as the spermiation. Alright. So, let us see a little bit more about spermatogenesis first, then we will get into oogenesis. So, in spermatogenesis, we know that the gonadotropins, the FSH and the LH both will play a role. You know that both the gonadotropins come from the pituitary after the stimulation from the gonadotropin releasing hormone. So, the LH will act on the Leydig cells, and the FSH will act on the Sertoli cells. So, right from my class 12th, I remember like the FSH, S for Sertoli cells, and LH for the Leydig cells. That is how I remembered. So, I am sure you know it even otherwise. So, what happens that the LH acts on the Leydig cells to make the testosterone, and this testosterone is used by the Sertoli cells to make the mature spermatozoa. So, that is the interplay. The FSH will act on the Sertoli cells to make the spermatocytes, the Sertoli cells will make the spermatocytes, but the Sertoli cells will require the androgens which are made from the Leydig cells under the stimulation of the LH. Alright. So, this spermatogenesis which is taking place in the Sertoli cells, we must understand the Sertoli cells are present in the seminiferous tubules, and 70% of the testes, 70% of the testes is the seminiferous tubules. So, how is this tubules, how these tubules housed in the testes? So, this testis, if you see, this has got something like 250 to 290 lobules. The testis is divided into 250 to 290 lobules. Some books roughly say 200 to 300, but the more precise number is 250 to 290. And in this 250 to 290 lobules, there are lots of seminiferous tubules, and in these tubules you see the spermatocytes are made from the Sertoli cells, and these Sertoli cells will release the sperms into the lumen of the seminiferous tubules, and then these sperms will collect into this retate testis. Can you see this retate testis? That's where they'll be collected. From the retate testis, they will go into the epididymis. See this part, this is the epididymis, and from the epididymis, this is still the epididymis. This will now change into the vas deferens here. So from the vas deferens, the sperm will go upwards to the ejaculatory duct, and then the secretions from the seminal vesicles will come and mix with this, and then the secretions of the prostate will mix with this, and finally they go through the urethra into the penis, and then they are ejaculated. We must note that the seminal vesicle fluid is mainly alkaline and the prostatic fluid secretion is mainly acidic. So ultimately the sperms which are released, they are a little bit alkaline in nature. So that alkalinity is used to counter the acidity of the vagina, isn't it? The net result of the mixing of the prostatic fluid and the seminal vesicle fluid is that the sperms are a little alkaline in nature. The the release of the semen is alkaline. So let's see this cut section of the seminiferous tubules in more detail. So in this cut section of the seminiferous tubules, I've marked some arrows to show you. Can you see these dark cells here? This is the seminiferous tubule here, and these dark cells here. Okay, these dark stained cells, these are the basal Sertoli cells which are making the primary spermatocyte, and then the adluminal Sertoli cells. Adluminal means next to the lumen. See, this is the lumen. So the ones which are near the lumen, these Sertoli cells are making the secondary spermatocyte, and then in the lumen, I have marked with these blue arrows. You see these dark cells, these are actually the mature sperms. So these, you will not see the tails in this cut section because the tails are not stained. So that's why you see these spermatocytes in the lumen, and once they are in the lumen, then all these sperms will move towards the retate testis, like I told you, and then into the epididymis. All right. We must also see that these Sertoli cells, okay, I'll show you here, that these Sertoli cells, they are at the base of this tubule, and they have in between of them a lot of tight bonds. There are a lot of connective tissues between these Sertoli cells which are keeping these Sertoli cells tightly bound to each other, and that's what is keeping the blood away from the lumen of this seminiferous tubules. So that's what is the Sertoli cells, and its the gaps between them are filled with connective tissues so that they are tightly bound to each other, so that they prevent the blood from coming into this area. So that's what is the blood testis barrier. It is basically made of the Sertoli cells. All right. Now I'm trying to show you this in a graphic picture here so that you can understand this better. So these are the Sertoli cells here, and this Sertoli cell is having the spermatogonia in the base. Can you see? And then the primary spermatocyte here. This is the primary spermatocyte, and then the secondary spermatocyte in the adluminal, the Sertoli cells which are near the lumen, and then the spermatid here, the next stage after the secondary spermatocyte, and the spermatozoa. Can you see the spermatozoa? And these are the tails of the spermatozoa which are towards the lumen, and then they release in the lumen by the process of spermiation. So what is this process where the spermatid is converting into the spermatocytes? So that process is known as the spermiogenesis, and in that spermiogenesis, what are the events happening? The events are, first is the condensation of the nucleus and formation of the acrosomal cap. The acrosomal cap is basically the Golgi apparatus, and then there is formation of the tail of the sperm, and the sperm will attain some amount of motility. So that is what is the formation of the spermatozoa from the spermatid. Now this changes to the mature spermatozoa. This changes are happening over 21 to 22 days, like I told you, and then these sperms are in the epididymis, and from then into the vas deferens. And you must remember that from the vas deferens to the time of ejaculation, the sperms are attaining more and more motility. So the vas deferens is having the sperms which are ready to fire, the ready to release sperms are in the vas deferens and in the epididymis, and the time taken from the epididymis to the vas deferens is roughly 2 to 6 days, and this is crucial 2 to 6 days in which the sperms will attain more motility. I thought that's one more bit I thought I should tell you now. So let's see the events in more detail here. See, the spermatogenesis starts from the spermatogonia, which is a diploid number, and then it changes into the primary spermatocyte, which is still a diploid number, 46 chromosomes, and the first meiotic division converts the primary spermatocyte to secondary spermatocyte. Now, this is your MCQ which comes in many exams. Which of the following is a haploid number? The secondary spermatocyte and even the spermatid and the spermatozoa is a haploid number, but the primary spermatocyte is a diploid number. Okay, but this has the secondary spermatocyte has the haploid number but double chromatins, and then after meiotic second meiotic division there is a single chromatid in the developing sperm cells or the spermatids. The spermatids here, and then these spermatids undergo spermiogenesis like I told you, and that will give 4 sperm cells. So, we must remember that from one spermatogonia there is development of 4 sperm cells. So, that is about the spermatogenesis. And how is this different from oogenesis? Let me tell you upfront that from one oogonia only one mature egg is made. Only one mature oocyte is made. That is the difference between spermatogenesis and oogenesis. From one spermatogonia, 4 sperms. From one oogonia, 1 oocyte. But the genetic material, the nuclear material is split just like in spermatogenesis, in oogenesis also. So, yes, there are 4 mature sperms. In oogenesis, there is formation of 1 oocyte and the remaining genetic material is equally distributed into 3 polar bodies. Alright. So, eventually there are 4 parts made out of the oogonia also, but there is 1 mature oocyte and 3 polar bodies. So, that how many polar bodies are released in so many ovulations, like that one question was there in your exam. That is why I am stressing about this part here. Okay. So, let us see in oogenesis how things happen. Now, when does oogenesis start? We must remember oogenesis starts right from the intrauterine life of a girl. You know, if a girl is having oogenesis, she starts it when she was in the mother's womb. As early as 8 weeks of intrauterine life, there are a lot of primordial follicles, and these primordial follicles, which start forming as early as 8 weeks of intrauterine life, they reach up to 6 to 7 million at 20 weeks and 1 to 2 million at birth, and around 3 to 4 lakhs only are remaining at puberty. And from puberty onwards, 1 oocyte, 1 egg, okay, 1 oocyte or 1 egg is released every month. So, what we must understand by this story, of course, this story was already discussed with you in the chapter of menstrual physiology in this app, but I am just revising here that right from the time of intrauterine life, 8 weeks onwards, the primordial follicles are made, and then after 20 weeks of intrauterine life, these primordial follicles only reducing. You see, from 1 to 2 million at birth, there are only 3 to 4 lakhs at puberty, and every month only 1 will be released, and there will be a lot of atresia of a lot of oocytes happening throughout the life of this girl, and all these 1 egg gets matured and is released every month, but the remaining keeps getting destroyed. So, what happens finally? At the time of 12 years onwards, 1 mature oocyte is released, a lot of destruction of the other oocytes is happening. So, from 12 to 50 years of life, around 450 oocytes are released, and remaining all the oocytes get degenerated. That is why by 50 years of life, all the oocytes are destroyed, and that is why we say the woman has reached a menopause. Now, let us see what happens in oogenesis now. So, right from that intrauterine life stage, there is this oogonias are present, and these will convert into primary oocytes. Now, when they become primary oocytes, there will still be a diploid number, but when they become secondary oocytes, they become haploid in number. Okay. So, this is the first meiotic division. The first meiotic division starts in the intrauterine life of this girl, and the primary oocyte will rest in this first meiotic division itself, and then this converts this this process of oogenesis will start when the girl gets mature. So, the oocyte is resting. The oocyte is resting in the first prophase, prophase 1. The oocyte is resting in the first meiotic divisions prophase, the first prophase, and the prophase is also divided into leptotene, zygotene, pagitine, diplotene and diagenesis. So in that it is resting in the diplotene stage. So the oocyte is resting in the first prophase in the diplotene stage, and then this resumes at the time of ovulation. So the girl is born with a lot of primary oocytes, and when she gets mature around 13 years of age, this meiotic division is resumed at the time of the menstrual cycle starting in a girl. So yes, this converts into a mature oocyte, a secondary oocyte at the time of ovulation. So when she ovulates, this secondary oocyte is released and the first polar body is released at the time of ovulation. Okay, so when ovulation happens, there is resumption of the meiosis division and the first polar body is released. Now the oocyte which is released is in the second meiosis. Now this meiosis 2 has started, the oocyte is released, the secondary oocyte is released, it is in the second meiosis, and that stage is known as the metaphase 2. So when this oocyte is released, it is a M2 oocyte. At the time of ovulation, there is a M2 oocyte, and that oocyte has one polar body. Now this question has asked many times in your exams, when is the first polar body released? At the time of ovulation. I know it can start as 24 hours before the time of ovulation according to your anatomy books, but please, it's a very specific question. My IVF is based on this question, so do not get confused. The answer is straightforward, that the first polar body along with ovulation. Don't even say just before ovulation, say at the time of ovulation. Okay, so ovulation happens and this is a metaphase 2 oocyte, and now this will not change till gets fertilized. Okay, a lot of girls ovulate every month, but the oocyte will be at M2 oocyte stage with one polar body in its periphery and it will get degenerated. But if this gets fertilized by the sperm, the M2 oocyte, the metaphase 2 oocyte will get fertilized by the sperm. You can see that metaphase 2 oocyte will now get fertilized and release the second polar body. All right, so the first polar body was released here, and then this is the second polar body which is released, okay, which is after the fertilization by the sperms. So the M2 oocytes, when it gets fertilized by the sperm, it releases the second polar body, and the first polar body also splits into two. That's why eventually one mature oocyte and 2, 3, 4. There are 4 genetic material parts. There are 4 parts from the first oogonia stage. There are 4 parts made, but the oocyte is only one mature, and then there are 3 polar bodies. All right, so let's not get confused about this anymore. Okay, in this picture, I just wanted to show you all the stages of development of the oocyte, because we get confused when we see this picture so many times. From the primary follicle, there's a growing follicle, and then this follicle over time matures into a mature follicle, and then the oocyte is released at ovulation, and this follicle which becomes a corpus luteum yellow body. All right, corpus is body, luteum is yellow, and then it gets regressed. So these are the stages, and in this graphic picture they are showing all the stages. It's not that in one cut section of the ovary you see all the stages together. Now that's where a lot of us get confused. I used to get confused in class 12th. So remember that this oocyte has been shown in all its stages of growth and maturation in this one cut section. It's not that in one cut section you will see all the stages together. All right, just for information, I know most of you would understand that this is just a representation. So what happens after ovulation? Let's see. Now when the oocyte is fertilized after ovulation, where does it happen? How does it happen? So let us see. Uterus, vaginal opening, and now this is the posterior fornix. If you imagine the uterus like this, and this is the vagina. So if you see it like this, so the vaginal opening and the vagina, which is all around the cervix, it makes 4 fornices, top and back. anterior, posterior, left and right. There are 4 fornices, 4 corners rather, in an easy way to understand. So, the posterior fornix, this is the posterior fornix. So, in the posterior fornix, when intercourse happens, in posterior fornix the sperms are released, and here when the semen rather is released here, the motile sperms will make the journey into the cervix and upwards. So, what helps the journey? The cervical mucus. The cervix is wet with the cervical mucus, and in that cervical mucus the sperms can swim through. So, that swimming of the sperms is possible when there is good cervical mucus and sperm interaction. We have read about that in the infertility chapter, and then the sperms move up. So, in the cervical mucus, now a lot of people say, what happens in the cervical mucus? The sperms get ready for fertilization. That is what is known as capacitation. Now, there is a controversy recently from the last 1 or 2 years. We've been reading a lot more books, and the physiologists have come up with some more explanation on this. So, traditionally, even in my book right now in Novak's Gynecology, we know that the sperms get ready, that is capacitation, that happens in the cervical mucus. But yes, the Ganong's physiology book says that it happens somewhat higher at the, you see the fallopian tube here, they say it happens in the proximal part of the fallopian tube here. So, proximal tube, that is also come into the fray by the physiologists. So, now there is a problem that when you people ask where does the capacitation takes place, it's very difficult to pick up one, but since the Ganong physiology is a more recent edition and that's more recent information of research, if you are given a choice between cervical mucus and the proximal part of the tube, please pick up proximal tube as the site of capacitation. Although I know that the gynae books do give cervical mucus, please pick up proximal tube as the site of capacitation. So, what happens in the stage of capacitation? That also is something which you should understand. Capacitation is something which is the preparing of the sperms for the purpose of fertilization, that is the sperms getting into the oocyte. So, what is happening here? There is influx of the calcium ions, and then there is the tyrosine phosphorylation, that is basically attaching of the phosphate bond, and you know that that's happening only when there is presence of ATP. So, the energy, the process of getting energy to move, that is what is the tyrosine phosphorylation, and then removal of the inhibitory influence, inhibitory cholesterol. So, removal of the cholesterol, tyrosine phosphorylation, and the influx of the calcium ions, this is what is the process of capacitation, that is the sperm is basically getting ready for fertilizing the oocyte. So, what happens at the site of fertilization, that is happening in the ampulla? You know that the oocyte is having the ooplasm here and the genetic material which is dispersed. There is no nucleus in the oocyte, mind you. So, the genetic material is dispersed, and this oocyte is protected by the zona pellucida. This zona pellucida is actually a tough thing to break for the sperms. I'll revise my statement. It is tough for one sperm to break it. So, when the the first sperm, which is the most the fastest active sperm, when it comes for fertilization to the oocyte, this oocyte will not allow the sperm to get inside, because one sperm just does not have the capacity. So, the sperm is ready to fertilize by capacitation, but it needs many sperms to actually break their heads. The acrosomal cap, this cap should rupture and release acrosin, and that is a hyaluronidase. It's a hyaluronidase kind of enzyme, this acrosin. This acrosin of 100,000 sperms, 1 lakh sperms otherwise, so many sperms, yes, so many sperms are required to come and release the acrosin the sperms will literally come and break the heads. That's what we say, you know, breaking the heads. These sperms will come and break the heads and release the acrosin, and then the zona pellucida will get softened when acrosin from 100,000, 1 lakh sperms is released at the site of fertilization, and finally one sperm will get inside. Now, when one sperm gets inside, how does the oocyte decide not to allow any more sperms to come inside the oocyte anymore? So now the oocyte will release a lot of cortical granules in the perivitelline space, somewhere here. In the perivitelline space here, a lot of cortical granules are released. So that is what is known as the cortical reaction. By this cortical reaction, the oocyte will become hard again to penetrate by any more sperms. So yes, the oocyte softens up with the acrosin of around 100,000 sperms. One sperm gets inside, fertilizes the oocyte, and a cortical reaction takes place, which makes sure that no more sperms can get into the oocyte. That ensures a normal number of chromosomes. Otherwise, rather than becoming diploid, zygote, it will become triploidy, isn't it? If two sperms get inside, there will be two sets of genetic material going into the oocyte. Oocyte has its own genetic material, so there will be a triploidy, isn't it? So this is the process by which one oocyte is fertilized only by one sperm, and this is what I wanted to convey to you after the discussion on gametogenesis. Parting statement, I just want to tell you, why do only a few oocytes survive from the intrauterine life till the extrauterine life after birth? That is, why do only a few oocytes survive? There is a small basic about that. I told you there are a lot of primordial follicles, the primary oocyte. So most of these oocytes degenerate, but some oocytes get a protective cover by granulosa cells. See this oocyte, granulosa cells. So those oocytes which have a granulosa cell covering, they get protected. The other oocytes which don't have this granulosa cell covering, they get destroyed by atresia. So this protective layer of granulosa cells, so this oocyte and this oocyte will survive in the intrauterine life and the extrauterine life because they are protected by the granulosa cells, and all these other oocytes will undergo atresia. So that's why when you see from the intrauterine life, they are at 20 weeks, they are 6 to 7 million oocytes, and at birth they are only 1 to 2 million. That's because a few oocytes were protected by the granulosa cells. So that was the basic about the gametogenesis chapter, and I hope you got the understanding of the various terms which was given in the spermatogenesis and the oogenesis and the primary spermatocyte and the secondary spermatocyte. All these do come in your exams, not in a very regular manner, but sometimes every once in a year at least. Any more doubts if you have on this, you can always contact me on the PrepLadder forum or on my email. All right, best wishes.